The medicines all help to the extent of about doubling the success rate of people who are trying to quit without medicines. So each one of them has pros and cons, and they all help. None of them are close to 100%. So if you go into it and you're in a group that has a 10% success rate, then you'll have about a 20% success rate if you add one of the medicines. Some people have 1% success rate. Depends on what factors, what kind of factors describe your age and your degree of addiction and a bunch of other things. You can predict how likely you are to quit and how motivated you are. But the medicines will about double it. Yeah.
So, am I understanding you correctly to say that if you have COPD and if the lung damage has been done, that there's no way to reverse that, but can you improve your lung function, like through exercise, through eating healthy, through not smoking, to where over a period of time you can do some of the things that you weren't able to do before?
Yeah. The lung function doesn't get better, but remember that although the lung function is the most widely used numerical measure of how bad is the lung damage from COPD, it is not the ultimate measure of what a person can do. Some people, I have had some people who have an FEV1 as small as 500 milliliters, who are still working full time and not limited in their activities. They're not running 10-mile runs, but they are able to do everything they want to do, including holding down a full-time job. And other people with FEV1s of 800 or 1,000 milliliters that are much more debilitated. So that number doesn't really define for every person what you're going to be able to do. It's 500 is more limiting than 800 is for an individual. But some people with 500 are quite better able to cope with it for some reason. And a lot depends on what else is wrong with your health, on what good shape you're in, what your level of exercise, your accustomed exercise is. If you take somebody with any level of lung function, judging by the pulmonary function test, and go through an exercise program, you will be able to do more when you finish the exercise program than you could before you started. Because the exercise training allows you to make better use of the lung function that you still have. So that number, a lot of people are surprised that when they go through a pulmonary rehab program, and they see that they can do a lot more without feeling so out of breath. Can't believe that the lung function tests haven't changed a bit. But those numbers, you don't have to change those numbers in order to make yourself feel better and actually be able to do more exercise. You can do more with what you have.
Question, please. When I started smoking, I was smoking 3.5 to 5 packs of cigarettes a day, which is a little bit excessive. Ever since I quit, I have craved cigarettes every single day. And if I ever pick one up, I'm afraid I'm going to have one in between each finger, smoking like this. You mentioned something about counseling. Do they have cigarette counselors? And do you think that would help? Do you ever hear people still craving it every day after 25 years?
Oh yeah, that also varies a lot from person to person. Some people who are former smokers become very avid anti-smokers. It's like getting converted to a new religion and then you're the biggest supporter. Other people quit smoking and they still crave a cigarette every day of their life. It can be 20 years later. It varies a lot from person to person. And the best thing to know about cravings is that they go away whether you satisfy them or not. You have one, you feel like, gee, I want a cigarette so bad, I haven't had one in a long time. I'm going to feel this way until I have a cigarette, or I'm going to have to live with this feeling. But if you just ignore it, it will pass. So cravings go away whether you satisfy them or not. That's an important thing to know when you're trying to deal with them. But they're going to come back, and you just have to get used to that.
I used to satisfy them with food. I've recently lost 50 pounds already. I'm afraid I'm going to go back to the food to keep satisfying the need to smoke or want to smoke. So I hope I somebody to help me. I talk to me.
I smoked more back in the day, easily for 50 years. Did a lot of customer entertainment and stuff. And I picked a day. You got to pick a day and stick to it. I picked my wife's birthday and our anniversary the same day, 1986, at 9 a.m., August 18th. I used to crave it all the time, but you're rid of the addiction. You still have the idea of loving it. I'd rather smoke than eat. And I really enjoyed it. Never thought I could survive without smoking. And I have nightmares about it still, but I don't crave it, unless I watch a Humphrey Bogart movie. But really, you're not addicted any longer. You're just craving it, or the idea of it. That's the way I am, anyway.
One thing that really helps to suppress cravings is exercise. Exercise is in animal research that you can decrease rats craving, rats, if you get them addicted to nicotine, there are ways to do that, then you can show that if you exercise them a lot, they crave it less. And it's certainly true for people. If you exercise, it makes you want both food and cigarettes.
I was doing this kind of exercise.
Maybe if you do it while you're at home.
Exercise in 1996, my doctor told me that I was working in MCD in the lab. I was exposed to all the chemicals and everything in there. And he said, you've got to park right in the deck and walk in. You can't walk like you did. So that was 96. And since 96, I have lost 50 pounds. I have not smoked, and I'm exercising 3 to 4 times a week and eating healthy, and I'm better than I've ever been. Cancer survivor as well.
Yeah, it's certainly true. The use it or lose it is certainly true with all muscle activity. And the more active you are, the more you will be able to remain active and increase your level of activity. It doesn't take long for sitting around to actually reduce your ability to get up and do things. And it takes shorter and shorter period of time as you get older. So when you're 60, if you sit around for 2 weeks and then try to go back to what you were doing, you will feel the difference. You won't be able to do as much as you do. And the older you get, the shorter period of time it takes to get.
What effect on lung function does the mold, the pollen?
It varies a lot from person to person. The question is about the effect of pollen on lung function. And if you're allergic to it, then it can cause a worsening of asthma, so your lung function gets worse. FEV1 vital capacity
What
goes down.
happens to it when you breathe it in?
Well, most pollen, and pollen comes in different sizes. Most of the pollen that's around this time of year is fairly large particles, and it affects mostly the nose and sinuses. So you get a lot of nasal congestion, and sneezing, and eye irritation, and stuffiness, and sometimes leads to a sinus infection. But what can happen is then a lot of mucus runs down the back of the throat, gets down into the lower passageways, and it can have inflammatory cells and inflammatory chemicals in it that actually stirs up what's going on. It stirs up lower respiratory function as well, and can make breathing.
And if you don't have those symptoms, it's not bothering you?
I don't understand what you mean.
You know, all this that you mentioned. If you don't have those symptoms, is that because the
Well,
pollen?
even people who aren't allergic to pollen can sometimes have kind of very slight degree of the same kinds of symptoms. A slighter degree of the same kinds of symptoms. Some sneezing, maybe a scratchy throat. But most of the reaction is on the basis of allergy. And for tree pollen, it's a little bit larger than grass pollen, so it's usually nose and throat and stuff. Grass pollen's a little smaller, so it'll make it down deeper directly.
In connection with asthma, if you know you have asthma, would it be better to go for allergy testing?
If you have asthma and you need to take medicine regularly, you should be going for allergy testing at one time or another. And the purpose of finding out what you're allergic to is primarily so that you can know what it is and try to avoid it. Some things are pretty easy to avoid. You find out that your major allergy is cats. And you can say, well, I'm not going to have a pet cat. I'm going to stay away from cats. That's pretty doable. If you're allergic to dust, which means dust mites, that's harder. You have to do a lot to your house and change the way you do cleaning, the way you furnish your house. And it's harder to do, but it's also valuable information. You can do it and you can benefit a lot from it. If you're allergic to mold, there's not much you can do about that because there's mold everywhere. You stay away from things that are obviously moldy, but beyond that, you're going to have mold exposure anyway.
Includes old buildings too, doesn't it? Like if you like to go in, some older, like bed and breakfast places might be in older homes. And I have found staying in a couple of those that it triggered, it just has a different smell, I think. It's kind of just old.
Yeah, and it can be very difficult to pin that down too.
Yeah.
Some places, when you go in there, you can sense that there's some kind of an odor there, or even a different feel of the air. And it's very hard to pin down exactly what that is. It could be mold, or it could be something else. It could be they burn scented candles, or it could be an allergic reaction that you're sensing, or it could be an irritant reaction. Not every exposure that you have that produces an uncomfortable reaction is an allergy. If it doesn't have an allergic basis, then it's an irritant reaction. And particularly with regard to breathing, there is an entity in this category of obstructive diseases called vocal cord dysfunction, which is sometimes referred to as irritable larynx or laryngeal asthma, which is very common. And it's common in people with asthma. It occurs in people who don't have asthma who are mistaken as asthma. So if the obstruction occurs down in the airways of the chest, then you're talking about asthma. If the obstruction occurs at the level of the larynx, then it's sometimes called laryngeal asthma, vocal cord dysfunction, or irritable larynx. And they both produce shortness of breath. They both produce wheezes.